My name is Ashley Dado, and I'm a junior at Mid-American Nazarene. I was 10 years old when I was first diagnosed with a medulloblastoma. It is a malignant brain tumor, and it's most common in children and young adults. The plug over here, it was scary. I really felt like this could never happen to me because we had no diagnosis in my family of cancer. And so it was really scary. None of us knew what was going on.
You never expect having a young girl to have that kind of news.
I cried a lot. To me, I felt like I was dying. So it was a very sad time for me. I didn't know what was going on.
She did everything she could to just try to be the Ashley that she knew, but that person was pretty much almost gone. You know, she was fighting for her life. We knew that, and she was just trying to do her best to do that. She developed a routine. She developed her own little schedule. She would get home from treatments in the afternoon and kind of sleep it off, and then she would plow through her homework to the point where she got ahead in school.
It changed my life a lot. My friends, they didn't know what was going on, so that kind of scared them. They kind of pushed back. And going through treatments was really scary because it caused a lot of side effects, like losing my hair and just making me sick and not feel very good. Well, due to the treatments and cancer, I have a lot of what they call late effects. And then my schoolwork and everything is different because of those late effects. So, like I can't do scantrons. I have a problem with hand-eye coordination. And my school allows me to take more time on tests so I can concentrate harder.
So late effects are health problems that can show up in survivors. Some of them actually show up, during treatment or right after, and those health problems continue into adulthood, like the endocrine problems that come up. But other late effects that can show up 10, 20 years after therapy include heart problems, lung problems, kidney problems, another form of cancer, and as we talked about, the emotional aspect of it, and the learning problems that can come up.
It's really important to me and, of course, many other cancer survivors that we have somebody who's there to transition us into adult care, and then that way they'll be able to have like our medical records and know our needs, and our former and current doctors to be able to talk back and forth.
Megan? Hi, Megan. The transition clinic is really important because here at Children's Mercy, they've been here with our physicians and our organization for some patients for just a couple of years, for other patients for 10, 20 years. And so it's a little scary to leave and go out into the adult world because they're so used to being here at Children's Mercy. And this transition clinic really helps the survivors to have a place to go, but it also really helps relieve the stress and anxiety of parents as they're nervous leaving Children's Mercy Hospital.
When they first told me I was going to transition to, KU Med, I was just nervous that at first they wouldn't know all my needs and things like that, but I'm glad now that that was explained to me and that they'll be there to take care of me just like people at Children's Mercy.
My name is Morgan Simpson. I'm 21 years old. I was diagnosed with non-Hodgkin's lymphoma when I was 14. I underwent 7 months of chemotherapy, and I am now 6 years cancer-free. It was just kind of one of those things that in order to make myself better, I knew I had to do it. I wouldn't let anybody else do it. My stepmom is a diabetic, and she goes, she does it every day. So she said, I'll go ahead, I'll give it to you. I'm like, no, I want to do it. It's not that I don't trust her, I just felt more comfortable doing it myself. This picture actually was my very last shot that I did at home, and so we decided we should probably snap some photos of it. I had to wear gloves, as you can see, and I always made sure before I did it that my leg was numb and I couldn't feel it. So pretty proud of myself for being able to do that. So
the Tour de Barbecue's impact has been huge because they have funded the nurse navigator position and allowed us to start the transition clinic at KU Hospital.
To have an adult clinic dedicated to the care of adults who are previously survivors of childhood cancer is quite rare. There are only a handful of those across the country, and even in particular in the Midwest, there are very few. And ours is a bit unique also in that it's a collaborative relationship with Children's Mercy and KU Medical Center.
I think the patients and parents are very excited about the position of the nurse navigator at the Survivorship Transition Clinic because it makes them feel like someone is listening to them and can help them through what could be a scary process, and know that they still have a person that they can contact, much like their oncologist that they had throughout their treatment.
Anytime someone makes a care transition from one doctor to another, that's a frightening process and provides some uncertainty. I think in particular that leap from the pediatric world to the adult world is a frightening one for patients and often for their parents, because their parents are often still very involved in their care. And truly, I would say as a provider, there's nothing more rewarding than having a patient come to see us and see an element of relief or comfort in their face, knowing that we're familiar to their previous care team and their previous care team is familiar with us, and they know that there's an open communication and dialogue that happens with those care teams. And I think that's important in all care transitions for patients, but in particular when you're moving from the pediatric world to the adult world.
I work on the oncology unit at my hospital. I had a patient that recently came in and he was diagnosed with colon cancer. He had never been in the hospital, never had any procedures done, nothing. And so I was able to go into his room and I was getting his vitals, and he was really kind of down, and I knew what his diagnosis was. I didn't want to bring it up because people take things differently. And I have a tattoo on my wrist that says Hope, and it has the O is my cancer ribbon, and it's lime green, and it caught his attention. And he goes, "What's that?" And I said, "Well, I'm a cancer survivor." And his eyes just got really big, and he's like, "You're way too young." And I said, "I was 14 when I was diagnosed. I'm 21 now." And he goes, "Well, I was just diagnosed today." And it was hard for me. Like, I wanted to just start crying. I was like, oh my gosh, okay, I can do this. This is what I'm supposed to do. And so I just sat there with him and just talked to him. And he said he was nervous. He didn't know what he was going to have to go through. He was getting blood transfusions at the time. And I asked him how that was making him feel. I remember having to get those and taking Benadryl, knocking me out, and all that fun stuff. So it was just really cool for me to be able to sit down and share my stories with him, and I hope that it helps him.